going to include me touching you and having you move around a little bit. Is that okay?
That's fine.
All right, and then I'm going to adjust the bed. I'm going to do an environment check, and then I'm going to provide privacy as well. Okay, and then before we get started, I'm going to be asking you a couple of questions. So I'm going to look at your armband. And can I have you state your first and last name and date of birth?
Alexis Bellows Mendoza, 6/21/93.
Okay, and do you have any allergies?
Nope.
All right, and then I'm also going to ask, see if they're alert and oriented. So do you know who the current president is?
Joe Biden.
Okay, and do you know where you are?
At West Coast University.
Okay, do you know why you're here?
For a physical exam.
Physical exam. And then do you have a general idea of what time it is right now?
It's about 4 o'clock.
About 4 o'clock. Okay, and then I do have to ask all my patients this. Do you feel safe here?
Yes.
Do you feel safe at home?
Yes.
And then do you have any thoughts about hurting yourself or others?
No.
Okay. And then last thing would be just that previous vital signs were taken. So all vital signs, there were no abnormal findings that were documented, so they were within normal limits. Okay, and then to go ahead and get started, I'm going to get started with checking your skin and your hair distribution. So are you okay without gloves?
Yes.
Okay. So I washed my hands per CDC guidelines previously. So I'm going to feel around the forehead and going into and checking the hair, separating it by inches, and feel around the entire head onto the back of the neck. I'm also going to check on the mandible area. So hair distribution looks even and normal. I don't see any infestations. The skin is normal for ethnicity with a pink undertone. There's no scarring, bruising, or pain during when we're palpating. And then I'm going to go ahead and move to the ears. So I'm going to go ahead and pull back like this. And then check the other side. Okay, I don't see any drainage or any abnormalities. Everything looks normal. And then I'm going to go ahead and move to inspecting the nose and the mouth. So if I can have you lift your head up for me. Okay, I don't see any drainage. It looks even, and I don't see any edema or anything like that. Can I have you open your mouth? And stick your tongue out and go, ah. Okay. Mucosa looks pink and moist. There's no, the patient has all teeth, and I don't notice any cavities or any abnormalities. There's no edema or bleeding or drainage anywhere. And the palate and the, everything is midline. Okay. And then now I'm going to go ahead and move to the neck and check her trachea. So I'm going to go ahead and feel around. Do you feel any pain or tenderness as I press?
No.
Okay, I don't feel any bumps or masses that should be rare. Can I have you swallow for me? Do you have any trouble with that?
No.
Okay. And then the trachea is midline or is centered, is not deviated, and I don't feel any bulging masses or anything. So now I'm going to move on to doing the lymph nodes. So I'm going to check the preauricular, the post. I'm going to check the occipital and the submental. And then submandibular, the retropharyngeal, and then the or anterior cervical chain, and the deep cervical chain, and then the the posterior cervical back here. And then lastly, the clavicular lymph nodes. Okay, and there were no swollen lymph nodes were noted. And then I'm also going to go ahead and check the carotid artery for her pulses. So I'm going to do that one at a time on the sides. I'm going to check here. And then I'm going to check this side. Okay, the pulses are even and have a normal rhythm. I don't feel any bounding. And then I'm also going to listen as well to her, okay, with the bell. So, and I'm just going to replace my fingers with the bell. Okay, I'm going to do the same to the other side. Okay, and upon listening, there were no bruits noted, and the pulse was not bounding or irregular by any means. Okay, and then now I'm going to go ahead and compare the carotid, her pulse here, with her apical pulse on her fifth intercostal space on the left side. So I'm going to go ahead. Okay, so. Actually, shoot, I'm sorry, left side, sorry. Okay. Okay, and the pulses were palpable, regular, and rhythmic, with 2+ amplitude, and they were even, so. Okay, and then the last thing I'm going to assess for is JVD, so I'm going to use my pen light. I'm going to have you look that way, and the other way. Okay, and no JVD was noted. And
okay, so good presentation. Any comments from the group? Any comments? All right, so let me give the feedback. Christina, you did a good job for the first time presentation. All right, so for section 1, you did good. Don't forget to make sure that you also ask, do you have any pain in any parts of your body, right? That's in section 1, right? Mm-hmm. You did ask everything, and that was good. So for section 2, when you are assessing the hair, and this is for everybody, okay, not just for Christina, for everybody, when you're actually examining or assessing the hair, if the patient has a bun or a ponytail, they're supposed to loosen their hair, okay? And you're supposed to separate the hair, at least for the practicum, 2 sections here and 2 sections here, okay? And you're actually showing the scalp because you're actually examining and assessing the scalp. And after you assess the scalp, you run your fingers through the entire, from the front to the back, palpating and making sure that there's no mass palpated. And then you would start with your skin assessment, which you are supposed to use your dorsal part of your hand, which you did. And you would say skin warm and dry and intact, pink undertone, even color. Okay, you don't say normal at all. In your assessment, you don't say normal. You have to state what is normal, right? Because you can be deducted points if you say it's normal, okay? So you would say skin warm and dry and intact, even color, pink undertone, no scars, no lesions noted, no mass noted. And then you would check for edema, the mandibular bone here. Look at me. Here. You use your 3 finger pads, you press hard. and remove your finger and watch for the skin to bounce back. You don't do it tenderly. Press hard against the bone, let go, and see whether there's indentation on the skin. Okay? And then for the skin tinting would be below your clavicle, right? Pinch bilaterally below the clavicle, and you would say, no skin tinting, no edema, noted. For the ears, you did very good. For the nose inspection, you have to make sure that the patient is still tilting the head like this, and you're shining the nostril one at a time. And the most important thing to remember, you have to say no deviated septum, no hole on the septums, no polyps, no drainage, right? No lesions on both nostrils, okay? For the mouth, you have to make sure, because you can be deducted points, you have to make sure when you're assessing the mouth that your patient is opening the mouth as wide as they can and the tongue is actually out, because you would like to see whether the uvula is midline, and you have to ask your patient to say really loud so that you can see that the soft palate is vibrating symmetrically, right? Right? Okay. And then you would ask the patient to lift the tongue up, because you're also examining with the use of your pen light underneath the tongue. So you would say your findings then: uvula midline, okay, soft palate vibrating symmetrically, tonsils not swollen, mucosa pink and moist, no lesions, no drainage, no swelling, no bleeding on top and underneath the tongue, okay, and complete set of teeth if the teeth are complete, right? Yeah, that's for the mouth. Now, for the inspection of the neck, you look at the neck first and then palpate. Make sure you are just using one hand. Put your non-dominant hand on your back so that you don't go like this. Because when you're using two hands, you can accidentally palpate the carotid at the same time. And your patient can faint on you, right? Okay, so using all your finger pads, rolling, right? Yeah, Christina? Okay, so then after that, you would actually, the trachea, you did good with assessment of the trachea. You would hold with your all finger pads and your thumb lightly, and you ask the patient to swallow, right? And you would say trachea, midline, able to swallow with no difficulty. On palpation, no mass palpated and no pain elicited. After that, what are you supposed to do? You're supposed to go behind the patient, right? To assess for the thyroid, right? Yes? Okay. So when you are feeling for the butterfly in the neck, make sure that your little finger is resting on the clavicle and the tip of your finger pads and your finger is actually beside the trachea, right and left like this, and flat. So you're feeling for the butterfly. So don't go here because you will be palpating the carotid. It's middle of the neck, and ask the patient to bend the neck backward and do like this and push and palpate and push and palpate. And you would say what? Soft and what? When you're assessing for the thyroid, soft and what? Glass.
Smooth.
Soft and smooth.
Soft and smooth. The two S. Soft and smooth. And then you would say no swelling or mass palpated, right? No swelling or mass palpated. No pain elicited. So that would be for your thyroid. When you're doing your lymph nodes, you're supposed to do gentle circular motion. You just don't put your hand like this. You are supposed to do gentle circular motion. You're feeling for the lymph nodes. You did all the location of the lymph nodes, good. But your technique, you can be deducted points if your technique is not correct. It is supposed to be gentle circular motion, right? Yeah? Okay. Now, for the brewery, to save you time, because, you really have to pay attention to the time. You were taking a little bit longer. Of course, this is your first exposure and you did actually good. Okay, so you would actually just feel for the trachea like this with your finger pads and just slide your finger pads to the right or to the left. And there's your carotid. You can feel it right away. And immediately get your bell and replace your finger pads with a bell. Let the patient lean forward a little bit to your stethoscope. Deep breathe and hold. And then you listen. And you said to the patient, breathe. Again, palpate to the other carotid. Get your bell. Replace the finger pads. And you would again say, lean a little bit forward to my stethoscope. Deep breathe and hold. And then you're listening while the patient is deep breathing and holding. And breathe. Got it? And you would say at the same time, that will save you time instead of separating the palpation and the listening for breathing. So you would say carotid pulses, palpable, regular, rhythmic, even 2+ amplitude, no strong pulsation, no breathing heard on the right and left carotid. Got it? So you got it all together. For the comparison of the carotid and your apical pulse this time, you will be using the diaphragm of your stethoscope, right? Everybody, yes? So the diaphragm, you palpate and the diaphragm would be on the left mid-clavicular line, right? 5th intercostal space. You put your diaphragm there and make sure that you just do it quick for the practicum. But in the clinical area, you can actually take your time. So you would say the most important thing that you have to say, and you can be deducted points if you don't say this. You would say synchronous because you're making sure that the rhythm of the beats would be synchronous between the carotid and the apical pulse. So you would say synchronous, regular, rhythmic, even 2+ amplitude, no strong pulsation. Okay? Now, for the JVD, the most important for the JVD is you ask the patient to lean back 45 degrees. And then let the patient look that way. You shine on this side, look the other way, maintaining the 45 degrees and shine. Got it? Yeah? Okay, everyone, did you hear that? Did you do the checks and balances on how you would do that? That's section 1 and 2. Remember, you are under time pressure, so you cannot really stay so long in one area. Okay, so for section 1 and 2, you should actually just spend 3 to 4 minutes altogether when you're timing yourself. Okay, so you really need to practice to make it unconscious competence that you can do it even without thinking. Yeah? Any questions? Are we good? But you did good for your first try, Christina. It was good. And you were sequential and you just missed a few. And of course, the technique, you will have to master that. Okay? And you have to know where the landmarks. The landmarks is very important because if you are putting your fingers in the wrong spot or your stethoscope in the wrong spots, you will be deducted points for that. Got it? Okay, so I have a list of the student that already answered me for your practice practicum because I actually make it a point to come to the campus just to make sure that I help you guys out. And there are only 16 people that signed up out of 34. So make sure if you haven't signed up yet for practice practicum, please come even for an hour just to make sure that I can show you the correct landmarks. Okay? And don't wait to the last minute. I would advise, if I'm the student, I would go to February 17th if you can really do it. Because then, when you're practicing, you will be practicing with the correct landmarks. You don't want to go to the last minute and then the following week will already be the practicum because your brain will be trying to absorb it in such a short time. So even for an hour, that's all I'm asking from you guys. I know you guys are very busy, but please do come so I can actually help you out. Because I want all of you to pass. Because remember, if you don't pass the practicum, even if your score is 98% to 100%, you don't pass the course, and you don't want that. You know, you have already spent a lot of energy when it comes to that. Any questions? Yes,
Do we
Christina.
email you or sorry, it's Marie.
Yeah, Marie.
Do we
I thought-
email you to schedule, or we just respond to the Remind app?
Respond to the remind. That's the easiest way. You would just say, I want to come on the 17th in the afternoon, 5 to 7 p.m. If that's the last time that you can make it, then I will say confirm. Okay. But I would really advise all of you to come, even for just an hour, because it's very important that your landmarks are correct. Okay. And when you're doing assessment, make sure that you don't ever say normal or abnormal. You have to say what's abnormal and you have to say what's normal. Yeah? Okay. First of all, before you can identify the abnormal findings, you have to know the normal findings first. So any deviation from the normal would be abnormal, right? And that will alert you as a nurse to call the doctor perhaps, or find another nurse to help you out. Christina Sosa, you have a question? You were raising your hand.
Yes, Professor. I think you answered it. So I was gonna ask, how do we sign up for the?
Oh, okay. All you have to do is answer the reminder I sent you. I wanna attend the, and all the time and room number are there. And just say I can only attend 1 hour or 30 minutes. Even 30 minutes would really help you rather than not coming at all.
But
Okay.
we can actually stay there for more than an hour.
Oh yes, you can actually stay for the 12 hours, 7 to 7 p if you want.
Okay.
And if you have a partner, you can continue to practice together. And I will actually be there to critique you. That's not how you do it. That's not your landmark. And you can switch. Okay. You can attend all the 3 days if you want. Okay. For your own confidence, because you would like to build your confidence. Because physical assessment, the one that you learned before, don't even go there because that's not going to help you. Just in your brain, make sure that you're thinking, this is fresh to me and I have to start over again. Okay?
Thank you.
All right. You're welcome. Any more questions? Good? All right. So let's start with the eyes. You actually received my PowerPoint on today's discussion and lecture, right? Yes? Right?
Yes.
Okay, very good. Resonance, loud. Okay, let's start with that.
Professor, are you recording right now?
We will record when I start. Okay,
Oh.
thank you. Thank you for